We are live now. So dear viewers, dear friends, hearty welcome to this edition of Facebook Live, Dil Se Dil Ki Baat. So as the topic suggests, it's all about your heart care, cardiology. I'm Himanshu Sharma, your host for the day. This session comes through a number of requests that we received from our friends and patrons who wish that their families who have got cardiac problems, they should be made aware about the risks involved during the times of COVID, whether they need to take extra care of their elderlies or even themselves, those who have cardiac issues. Coronavirus affects respiratory system, and that's a no-brainer. Even if we ask a 5th grade student, would be able to tell us. One doesn't need to be a doctor for that. But this also brings us to a lot of gray areas that underline, thanks to the pandemic, the news, the information that we have been bombarded with. In this session, we try and uncomplicate some of these concerns. So we are going to largely cover a few specific aspects of cardiac healthcare. So if I have a bad heart, or if I have a weak heart, or I have a heart disease, can I be affected by COVID? Are my chances of getting COVID infection higher in case my heart pumping is not proper? Do our patients who are cardiac patients basically and undergoing treatment, are they at a greater risk of this disease? And lastly, which we all would like to hear, are hospitals safe? I mean, do you really, if you want to visit your cardiologist, is it safe or it's not? So we're going to discuss some of these things and many more with our wonderful team of cardiologists. Today's panel, I'm happy to introduce Dr. Abhisheka Tripathi, who is interventional cardiologist at Zydus Hospitals, Ahmedabad. Welcome to you, Dr. Abhisheka. And we have Dr. Rutvik Trivedi, who is again an interventional cardiologist from Zydus Hospitals, Anand. So I'm sure these are fantastic people and also people who are very good at heart, jolly people, very good at heart. So they're going to help us understand our heart care during the COVID times. So I welcome you both to the session again, and we'll initiate with Dr. Abhisheka Tripathi. Dr. Tripathi, during the pandemic, since the lockdown, and even now as we are entering the various unlock phases, the physical activity of common man has dramatically reduced. How does it affect heart patients?
Hi, welcome all. Himanshu, as you pointed your question, we know that physical activity or per se physical inactivity, sedentary lifestyle, this is a known major lifestyle related risk factor for heart related conditions. Now, lockdown was an unprecedented situation. None of us has seen that kind of situation. And that time everything was closed. Our venturing out of the home was also banned. All parks and gyms, they were all closed. So definitely that time physical inactivity was significantly there. No exercise was available, cycling, swimming, gymming, everything was stopped. Now, problem is even after now, the unlock is there. The facilities have opened. The physical inactivity because of inertia still persists. That's a concern. Now, one thing, physical inactivity on top of that, during lockdown, because we were locked in our houses and there was nowhere to go out, the dietary indiscipline also ventured in. So the patients who were following a very disciplined diet, they also started having indiscipline, and dietary indiscipline was there. On top of that, there was stress related with job, related to economy, related to business and all. So all these things, they combine together. Coming again to the physical inactivity and sedentary lifestyle, if these things are combined, we have to understand they don't work immediately. The benefit comes in time and the effect also comes in time. Suppose if we have stopped doing exercise, physical activity today, you are not going to have attack tomorrow. But what does it do in long term? Your good control of blood pressure is lost. Your good control of diabetes, sugar is lost. So a good number of patients, those who have well maintained with a fixed amount of drugs, with good control of blood pressure, now they are having blood pressure in the range of 150, 160. The patients who were having good control of sugar, now they are coming with uncontrolled higher sugar. The cholesterol levels are going up. The weight is going up. So all these things, uncontrolled blood pressure, uncontrolled sugar, higher cholesterol, increased weight, sedentary lifestyle, everything is going to ultimately affect our heart. So this is how the physical inactivity, if we continue longer, this is going to affect heart and going to create problems of your heart health in future.
Thanks a lot, sir. Thank you very much. So now we know that for all of us who have stayed home, relaxed, maybe enjoyed some great fried food, so things would start showing up and you might have to visit a cardiologist soon. Well, that was on a lighter side. Now I come to Dr. Rutvik Trivedi. Dr. Rutvik, patients, cardiac patients, many of them are on blood thinners. So thinning of blood, thickening of blood, any correlation does it have to COVID or their possibility of getting infected? If you can just throw some light on that.
Okay, Himanshu, first of all, hi to everyone. A very interesting question you have asked. So a lot of worries are there in the patient, those who are having cardiac disease, they are all concerned about this point. So I'll give that answer in two parts. First is the COVID itself and its relation with the cardiac complication. So the first part of related to COVID infection per se, yes. So COVID infection per se, we have seen that it is associated with the thrombotic complication, and most of the mortalities we have seen are because of this thromboembolic complications. We have seen patients of pulmonary embolism जिसमें lungs के अंदर clots हो जाते हैं. We have seen patients, young patients who have myocardial infarction जिसमें heart के अंदर clot हो जाते हैं. Lot of patients who are on ventilator, they have complication in the small branches of the pulmonary artery. That is microcoagulopathy or microangiopathy, which is seen. A lot of patients are bedridden because of COVID. They develop complication, thrombus formation in their leg veins. There are a lot of people who have developed young strokes. If you look at the data and compare with the seasonal data, like in this month, previously last year, before COVID, pre-COVID year, I had this much of stroke patients. And compared to this during COVID phase, of course, the stroke data has also gone up. So there's a strong correlation of coagulopathy with the COVID infection. So that needs to be treated. And in fact, those who are treating COVID, they always get a D-dimer done and treat them with the blood thinners like heparin or NOAX or Clexane. So this is the part, the first part of the answer. Now, second part, if you are taking blood thinners and you are at risk of COVID, of course not. So if you are taking medication, which is mandatorily advised to you by your cardiologist, say you are taking aspirin, you are taking ticagrelol, prasugrel, clopidogrel, maybe warfarin, because of a compelling indication, and you are at risk of COVID, of course not. You are not at risk of COVID. All the patient has to follow the universal guidelines which has been given by our government, that they have to wear mask. They should avoid touching, frequent touching to their eyes, nose, and oral cavity. Wash their hand frequently, use disinfectant frequently. If you don't follow this basic rule, then you are at risk. Whosoever is the person, whether he's taking blood thinners or not taking blood thinners, the risk remains same. So coagulopathy is strongly associated with the COVID infection, but those who are taking blood thinners for a compelling indication, that does not make them at risk of COVID infection. I hope I'm clear.
Thank you. You have clarified this concern. I'm sure there would be people who would be happy to understand what exactly it means when they are taking blood thinners and how their risk is. Dr. Tripathi, next question to you. Now, there are various kinds of heart diseases. Is there a specific set of patients or patients with specific diseases who are at a greater risk of COVID than others? If you can just share some information on that.
Greater risk of COVID, it's not that a specific heart-related patient is at risk of COVID, but the patients who are having heart disease, like those who have LV dysfunction, heart failure, weak heart, those who have past history of angioplasty or bypass, or those patients who have other heart conditions. If these patients, they have COVID infection, definitely in these patients, the risk of complication and risk of further affection of worsening of heart condition, it increases. But just because of virtue of having a heart condition, so you are at a higher risk of COVID infection, is not true.
Okay, thanks. So the risk for everybody almost remains the same. It's your additional conditions that put you at a greater risk or a lesser risk. Thanks for that, Dr. Abhisheka. Dr. Rutvik, next question is for you. Now, in these times, are there patients who need to be extra careful, those who have recently undergone some procedures, or they have recently been detected with a cardiac issue, not attended? Can you just explain something about that too?
See, first of all, as Dr. Abhisheka mentioned, that those patients who are having cardiac disease and those patients who are not having cardiac disease, I think the risk remains on the various other part which I discussed previously. But of course, you are having LV dysfunction, you are on cardiac medications. There were few concerns regarding whether you are taking ACE inhibitors and ARBs, whether they are at more risk of developing infection or they have more complication. And it has been clarified by various hypertensive and heart failure societies that if you are taking ACE inhibitors and ARBs, up till now we don't have any data. So during the month of I think March to April and May, we as a cardiologist also faced these various meetings where there were uproar that ACE inhibitors and ARB should not be given, or the patients who are taking ACE inhibitors and ARB, the drug should be discontinued. So it's not like that. You should continue your medication. The utmost important part is your control of your blood pressure. If you are diabetic, you should keep your diabetic in range. The sugar should be in range. If you are taking specific medication, as I mentioned, ACE inhibitors and ARB, there is no need to worry. You continue that medications unless you have a indication like you have hypertension, you have infection, and the doctor discontinues. That is a different thing. The same way, if you are a diabetic, continue taking that medication. But you develop infection, and the doctors ask you that you discontinue. That is one drug which is called as SGLT2, where again concerns were there that it should be discontinued. Otherwise, heart patients should not stop their routine medication. So that is the biggest request from the cardiologist and from all the physicians. And as you told, the emergency part, we have seen that the emergency numbers initially during the month of March, April, and May, we have seen slightly decrease number of emergencies, and that we were also discussing that why the emergencies are going down because of COVID or people are not coming. So various hypotheses are there, but of course now we are saying that those patients who are coming, in fact, they are the one who have ignored their complaints. So again, a request: if you are a cardiac patient, if you have minimal symptom, don't get feared. You should consult your whosoever is your cardiologist and physician, or wherever you are, go to the closest hospital, get yourself checked, because by the time you go and consult, you lose your cardiac function or cardiac vitality. So that is a very important part.
So the message from Dr. Trivedi is don't miss on the golden hour. It's very important for you to take things seriously, especially when it comes to heart. And please, please, please do not self-medicate, because that's a habit which many of us, I mean, obviously our culture has been like that, where we do self-medication first and doctors comes at the last. But with heart, one should not take those chances. As he mentioned about emergency, my next question is about the footfalls in emergency. Dr. Tripathi, we have seen that there has been a dip in emergencies, cardiac emergencies coming to the hospital globally, not only in our country, but globally during the pandemic. Now, any message that you would like to convey to patients, those who are ignoring cardiac symptoms, because we have many such people who have requested. I'm sure many of our viewers would have friends, peer group who have similar symptoms, but they are like, we can wait. Abhi hospital kyun jana hai? Abhi to COVID hai. So can you just give some details on that as well?
See, regarding emergency, as Dr. Rutvik mentioned, initially there was a panic regarding the COVID infection. There was lockdown also has prevented the basic logistics for them to reach to hospital. So these two were the basic common thing which prevented them to reach to hospital. Second thing, the common social mentality was there to avoid going to hospital. So this has caused more harm than any benefit. Initially, when the numbers were down, people were thinking probably people are happy at home, and this is why they are not coming. But there was a tendency, they were not only ignoring emergencies, they were ignoring semi-emergencies, they were ignoring all emergency kind of symptoms. Now, what happens in these kind of patients? Suppose if I take two set of patients, one group of heart failure patients, weak heart, and one group of heart attack patients. In weak heart patients, we educate them with quite a length of time, the family and the patient, regarding the importance of water intake, your weight monitoring, salt intake, and early warning symptoms. Because of this COVID panic and because of this lockdown and because of avoidance of coming to the hospital so that they should not catch infection, what happens if you come early when your symptoms are coming, like you have gained some small amount of weight, early symptoms are there. If you come to hospital, we can treat those patients on OPD basis and can send them home. If you miss that deadline, you have come with a significant amount of symptoms, significant worsening, decompensation of heart, then we have to hospitalize. Now you have to understand that these are avoidable, unnecessary hospitalization if you contact the doctor or hospital early. So if you recognize the early symptoms, don't ignore them, reach or contact your doctor. These hospitalizations can be avoided, one thing. Second, if I come to the heart attack patients, good number of patients, when they come with massive heart attack, they always have a 2-3 days preceding symptoms of some suffocation, some chest discomfort, some heaviness, or some kind of uneasiness after meal or after taking some short step. But they tend to ignore these symptoms. During this lockdown, we have found they have significantly ignored these early warning symptoms. If you contact your doctor during these early warning symptoms, the heart attack, the massive heart attack can be prevented and treatment can be delivered timely. Now in this lockdown, and because of avoidance of coming to emergency, what happened? Ultimately, they have come to emergency, but after damaging the heart significantly. Like you have damaged, you have ignored the symptoms for 3-4 days. Suddenly, one fine night, one fine morning, you had massive heart attack. Now you have come to hospital. Ultimately, our job is same. We are going to do the same treatment. But what is losing? We have lost a significant amount of heart. So even if I'm sending my patient back, the patient is going back with a weak heart. So don't ignore your early symptoms. Don't ignore your early warning signs. Any age is predisposed. In the last 7 days, I think we have received 6 young patients, 3 of them less than 30 years of age with heart attack and these things. And all of them were having early symptoms, but because of their age, they thought, I cannot have heart attack. One of the few patients, when they had symptoms, they wanted to avoid going to hospital because they will catch COVID. Now the important message is, why are you are trying to avoid hospital? To safeguard your health, so that you should not catch infection. Now, if you are avoiding hospital not to safeguard your health, that is not right. If your signs, symptoms demand visiting a hospital, visiting a doctor, please visit your nearby doctor, your cardiologist or your doctor at a hospital, and show them early so that the latter complications can be avoided. Because once a patient comes with a more complicated and delayed phase, what happens? Your condition is deteriorated, one thing. The impact on other organs are there, second thing. Your length of hospitalization goes long, third thing. The entire complete result and complete recovery from the said disease, the chances go down. So we are losing on every front. So if whenever you're having symptoms, try to reach your hospital as early as possible. And believe me, most of the hospitals, they are taking all necessary precautions regarding sanitization, regarding hand washing, regarding providing masks, regarding social distancing. So all hospitals, they are providing. So you have to use your common sense, as like Dr. Rutvik mentioned in the beginning, those universal precautions, they remain same. But beyond that, ignoring your emergency symptoms or early symptoms to the extent that we are complicating the situation is not right.
Thank you, Dr. Tripathi. So the take-home message from Dr. Tripathi's discussion is that please do not ignore your symptoms. Ignorance is not bliss when it comes to your cardiac symptoms. More delay you cause, there is a possibility that you'll have to spend more time in the hospital. And we try our best to make sure that our patients who come in here are treated at OPD unless there is a need of really in admission. So that's what Dr. Abhisheka was trying to reinforce. Now I come to Dr. Rutvik. Dr. Rutvik, we have been doing procedures, cardiac procedures during the time of pandemic, during the lockdown. I would just like you to brief it out to people that what are some of the standard protocols that you have changed or you brought about a change in the protocols for procedures which are performed in the cardiology department and the cardiac cath lab?
Yeah, very important and interesting question, because the practice has drastically changed when we compared with the pre-COVID era and the recent era of COVID infection. So first of all, those patients who are coming for a routine examination and we advise intervention, I think the protocol is very clear that we screen them at least via HRCT to look for any haziness, any shadow, any infection or is present or not. Whenever we feel that patient had a symptom, we ask them to get them either RT-PCR or antigen test, which is now available, so that not only the doctors, the staff, and the other patients, those who are not infected, they'll be safe. So this is for the stable patient who are coming for a routine examination, and we advise them for intervention. That is chronic coronary syndrome patients. Now, second part to an emergency part. Now, whenever a patient comes with the emergency, the options are very limited, because we have to treat that in myocardial infarction, because as Dr. Abhishek has mentioned, that time is very important and time is muscle. So we don't generally waste much time in reperfusioning the patients, but we have a protocol. So the first protocol, we look for the fever which is present or not in a screening. We have a different screening zone for this kind of patients. urgent HRCT is needed, so we just get a screen of HRCT. These patients were given priority. Patient and the adjoining staff will wear the full PPE kit. The performing doctor wears the full PPE kit. And after the procedure, once the over, we always try to deep clean and fumigate the cath lab so that the corridor on the cath lab part remains clean. So this is a protocol for the emergency patients. We generally don't delay on the basis of acute coronary syndrome. If patient had mild shadows, we don't avoid. We offer the base treatment, which is recommended face-to-face. Initially, there were few Chinese guidelines that thrombolysis should be offered, but later on, we all now believe that the primary angioplasty remains the gold standard method, and we try to reopen the vessel so that at least the heart remains stable. Specific way of specific corridor, deep cleaning, patient priority, PP kit, all these things we follow very meticulously so that patient, doctor, the relatives, and the other patients who are coming for the intervention, they are safe. So for acute emergencies, I think the best care is given at the Zydus hospital, both at Ahmedabad and Anand. We take care of the patients, relatives, other patients, and we don't compromise just by labeling that, oh, this is COVID, we are not going to touch you, you go to a different COVID zone. No, cardiac emergency, it has to be attended first. For stable patients, as I mentioned, every protocol which is now universally followed for the surgical part also, we follow the same protocol.
Thank you, Dr. Trivedi. It's quite reinforcing and quite assuring for people to know that all necessary precautions are taken by the hospitals to make sure that the patients are safe. And obviously, in case of an emergency, it's an emergency. It's not like a COVID or non-COVID emergency. An emergency is an emergency. So now, as we draw towards the end, Dr. Abhishek, one more question coming for you before we close for the session. Now, there are many patients. You've been treating patients from outside the country. There are patients who are in the other states who've been in touch with you. Now, blood pressure monitoring is one critical aspect of cardiac care. Now, for such patients, if they're not able to come to your OPD, what is the solution that you offer to them, and how can we assist such patients?
This is a very good question, particularly looking at this COVID era. There is a emergency situation, semi-emergency situation, then there is some elective situation. What happens for emergency, semi-emergency? Definitely you need to see a doctor. Doctor needs to evaluate you. Only then you should be rested. But then there are conditions like you have been advised for antihypertensive treatment. You are on BP medication, and there is mild fluctuation in BP. With some medication, but blood pressure still is 165, 170, lower one is 90, 95. Do I really need to go to hospital, or do we have some other facility available? So we have with us telemedicine facility available, where for these kind of trivial things, for BP monitoring, for titration of BP doses, for changing or increasing or decreasing the BP doses, not only for that, for diabetes, for stable patients, and one more segment of patients like the patients who are under valve replacement and those who are on acetylcholine or warfarin kind of medication, where they come from far off just to show PT-INR report. So I give you my own example, because one patient from Jodhpur, he comes every 3 months to show PT-INR report. Or some patients, they're coming from Rajasthan, from far off area, just to show their BP this thing. So I advise them to please take a telephonic advice for these complaints, because we need just a small titration. For that, patient has to spend his 2 days, 1 day coming, 2 hours spending in hospital, 1 day going. So 2 working days are lost for the patient and the family. 2-3 relatives are also coming. Traveling time is also included. Then the risk of exposure is also included. So these small trivial things like for adjustment of your anticoagulation doses in view of PT-INR report, adjustment of our blood pressure medicine doses when the BP range is not very high or very low. These things can be managed with telemedicine, where you can get these facilities available, face-to-face talking, and from the comfort of your home. So for these trivial complaints, we have telemedicine facility also available with us.
Thank you, Dr. Abhisheka. So for our viewers, we are available for you on telemedicine as well. In case you need any assistance for that, our doctors are available to assist you. Now, at the end, from both the doctors, I would like short, small message for the people who are watching this and society at large, that whatever you want to convey in terms of how safe is cardiac care now. Quickly, before we wrap up.
So I would sum up, now COVID, we have to live with COVID. Earlier we adjust, earlier we are safer. We have to use common sense. There is no substitute of common sense, as Dr. Rutvik mentioned in the beginning, like social distancing, no unnecessary entering in any crowded places. Mask, universal use of mask without any fail. I also have my mask. Don't think the doctor is not using and advising. And the frequent hand wash, even with soap and water, is sufficient. So using these things should be up now, as of now, till we have a good vaccine available. This should be a norm of life. Beyond that, please don't ignore your emergency warning signs of your heart. Don't ignore the emergency symptoms. If you have any cardiac symptoms, early warning signs, or emergency, please do visit your nearby hospital. Do visit your cardiologist. All hospitals are trying to keep the atmosphere as safe for you possible, as safe as possible for you. So don't hesitate in visiting the hospital if you really have this thing, because ultimately हम hospital क्यों नहीं जा रहे हैं? अपने health को बचाने के लिए. So if health needs, we should definitely go to hospital also.
Yeah, I think I agree with Dr. Abhishek by whatever you have said. I think the universal precaution has to be followed, and second part is don't ignore your symptoms. And third point I would like to add is that patients generally, I advise them to go to a hospital where all the investigation, all the facilities are available. Most of the patient I see, they go for one problem to a X hospital, for a second problem they go to Y hospital. In that sense also, I think the exposure time, the time wastage, as you mentioned, from Jodhpur, patient has to come, patient has to go 1 to 2 days spending, and then for diabetes management they go to a different hospital. So again, addition is 3-4 days they have wasted. So the exposure increases. So go to a hospital where all the facilities are available, and whenever your doctor advises for a specific investigation and admission, believe that, because there are a lot of mistrust and confusion exist in the society. And we doctor have seen during this phase, a lot of people were talking that, see, in COVID phase, the number of MIs have gone down, no strokes are there, no other complications are there. So there was over treatment. So it's not like that. We are common, and because of that, what Dr. Abhishek has stressed, that even though you spend money, we give the best treatment, but the results are not as seen or expected, because we have lost your golden hour. So don't be in confusion and trust your doctors. That is what the message is.
Thank you very much, Dr. Trivedi and Dr. Abhisheka. So we'll wrap up today's session with a take-home message that trust your doctors, don't avoid emergencies, don't delay early signs and symptoms. So we'll again request you to be safe, make sure you have your mask on whenever you are out in public places. Do not avoid any health symptoms that you are getting. With this, I would take leave from our viewers. A recording of this session will be available on Zydus Hospital's all social media platforms. Please feel free to leave a comment if you have questions, if you anything else that you would like to hear from us. Please do let us know. Till then, I'm Himanshu Sharma signing off for the day. Take care and stay well. Thank you. Thank you very much.
Bye. Thank you. Bye. Bye.